The rabies virus is a neurotropic virus in the rhabdovirus group, but it also has affinity for the salivary glands.
The incubation period depends on the amount of virus, that is the inoculation dose, and the points of bite, and can be 1 week and 1 year in natural infection. The virus travels via the peripheral nerves to the spinal cord and ascends to the brain.
Now, when the virus gets to the brain, it parasitizes the ganglion cells, it grows and spreads centrifugally through various nerves that emanate from the brain. Okay, now through the cranial nerves 7 and 9, which are the facial nerve and glossopharyngeal nerve respectively, the virus gets to the salivary glands,
from where it is shedded intermittently in the saliva. The virus can be shed few days before onset of clinical signs.
Now in the brain, the virus damages the nerve cells and the vascular endothelium. Irritation of the nerve cells causes increased excitability, which manifests in the various form of the disease. The affection of when it affects the medulla leads to fever, polyuria, and glycosuria. Then eventually, the nerves that are affected by the virus undergoes degeneration, which leads to paralysis of various muscles. Now, some of the muscles that get paralyzed are the muscles of deglutition, which prevents the animal from swallowing, and this is seen as a drooling of saliva. Jaw muscles get paralyzed, and this leads to the animal not being able to close the jaw, and it leads to the jaws hanging down. And also the respiratory muscles also get affected, and this is what leads to asphyxia and then subsequently death of the affected animal. Now, due to the affection of the vascular endothelium, perivascular coughing is noticed.
Diagnosis is the process of finding out if a patient has a specific disease.
You can diagnose rabies one through the clinical manifestation. There should be photophobia, there should be hydrophobia, that is fear of water, fear of light. The animal also tends to attack unprovokingly. It can also snap at moving objects.
They may also eat unusual things and hide in dark places. Other symptoms exhibited by an infected dog include paralysis of the mouth and jaw muscles, which leads to the well-known foaming in the mouth. Disorientation, incoordination, and paralysis of the hind leg are also symptoms experienced by an infected dog. Animals that are discovered to exhibit clinical signs are often euthanized.
Tests are carried out on suspected host animal. The brain skin tissue, biopsies on body fluids are examined in the lab. The test must, however, include tissue from 2 locations in the brain, preferably the brainstem and cerebellum.
So in the laboratory, you can diagnose rabies via immunohistochemistry.
What we refer to as Stellar's technique, and it is aimed at demonstration of intracytoplasmic inclusion bodies in the brain tissue.
You can also use electron microscopy, but the most reliable technique is the direct fluorescent antibody test, which usually comes out between 24 to 72 hours.
It aims at demonstration of the rabies virus protein as the rabies virus antigen in the brain tissue.
Therefore, there is a need to be proactive with prevention of rabies spread through thorough diagnosis of suspected animal hosts and human bites as a measure to curtail the transmission of the virus.
At the end of the day, everybody wins. Your pets, you, and everyone who may come in contact with your pets.